So today we will discuss about fibula. Okay. So fibula is the lateral bone of the leg and it is homologous with the ulna of the forearm. Okay. You can see here in this articulated legs. This is fibula. Okay. So it is homologous with the ulna of the forearm. In Latin, the term fibula means pin and hence the lateral bone of the leg is rightly named as fibula because it is a long pin like bone. Okay, it is a long slender post-axial bone. এখন হলো post-axial bone, and for forearm post-axial bone is ulna. Okay, and it does not take part in transmission of the body weight. It serves up two important functions. Important functions are it provides attachment to the muscle attachments are there, and its lower end along with the lower end of tibia forms a socket is known as tibiofibular mortise, and to hold it holds the talus in place forming the ankle joint. Okay, so see here the articulation superior tibiofibular joint here for plain synovial joint, middle tibiofibular joint formed by the interosseous membrane, that is syndesmosis or fibrous joint. Inferior tibiofibular joint is also a syndesmosis. Okay, these tibia and fibula forming together these three joints. An ankle joint is hinge type of synovial joint. At the lower end of tibia, it articulates forming the tibiofibular mortise, articulates with the talus. This one is talus. Yesterday you have seen bones of the foot. So it is forming the ankle joint. This is lateral malleolus. Lateral malleolus is part of the fibula. Medial malleolus is part of tibia. Okay, and you can see the head of the fibula articulates with the lateral condyle of the tibia. Okay, so what are the presenting parts of fibula? So fibula is a long bone, you can see, and it consists of these three parts: upper end, lower end, and the intervening shaft. The upper end or head, this is upper end or head, it is round and presents a circular articular facet. This circular articular facet which articulates with the tibia. Okay, an upward projection is located posterior lateral to this facet, and this is called the styloid process. This process you can see at the upper end, this is styloid process of fibula. Styloid process you have got in which bones? Radius and ulna. Okay, so here also another styloid process. Next, the shaft is described, and this location is important. This styloid process is located posterolateral to the head. Okay, and the shaft is described to have three borders and three surfaces. Three borders are anterior border, interosseous border, and posterior border. You can see here this border, this sharp border is the anterior border. Just in front of it, almost 3 to 4 millimeter away, this is interosseous border. Okay, and here is the posterior border, and this ridge, this is known as median crest. Okay, so these are the three borders, and in between the three borders here are the surfaces. In between anterior border and the interosseous border, medial surface, this is the lateral surface, and here will be the posterior surface, and this is the anatomical position of the fibula. This is fibula of right side. Okay, so the lower end of fibula is flattened. See, you can, this is lower end, it is flattened anteroposteriorly and bears a triangular articular facet on its medial surface for articulation with the talus. This triangular articular facet articulates with the talus, and behind and below this is a roughened fossa called the malleolar fossa. This depression you can see behind and below this triangular facet, this is known as malleolar fossa. Okay, so malleolar fossa will be behind and below this triangular facet. This is another point for holding it in anatomical position. Okay, you place your thumb in the malleolar fossa and index finger on the lateral side and hold it like vertically with the same hand to which side it belongs. It will be placed in anatomical position. Okay, and see here in this position, this styloid process is posterolateral to the head. Okay. So this we will discuss the presenting parts in details. First, the head of fibula. It is a small knob-like extension from the proximal end of fibula and that articulates with the lateral condyle of tibia. This part is the head, knob-like. And the head is attachment site for these muscles and ligaments. Soleus, biceps femoris, fibularis longus is the Peroneus longus. Okay, Peroneus longus and extensor digitorum longus muscles and the fibular or lateral collateral ligament, one ligament of the knee joint. Okay. Next, we are going to shaft of the fibula or body. It is elongated midsection of the bone. This part is the shaft. Okay. Shaft has different borders and surfaces. First, the interosseous border or margin. It is the sharp edge medial margin of fibula serves as the attachment site for the interosseous membrane and which binds the fibula to the tibia. Okay, this border is the interosseous border directed medially, giving attachment to the interosseous membrane. Okay. Next is lateral malleolus. This part is the downward projecting part, lateral malleolus. তোরা লাস্ট বেঞ্চ তিনজন ফোন নিয়ে কি করছিস তখন থেকে? অ্যাটলাস দেখার দরকার নেই তো এখন এখন যা পড়াচ্ছি সেটা শোন, পরে বাড়ি গিয়ে অ্যাটলাস দেখবি। এখানে সামনে উঠে আয় তিনজনেই সামনে উঠে আয়। কন্টিনিউয়াসলি কথা বলছে নাহলে ফোন নিয়ে বসে আছে। এখানে আয়, এখানে এসে বস। Lateral malleolus is pyramidal shaped downward projection from the distal end of the fibula. This is lateral malleolus. Lateral malleolus which extends more inferiorly than the medial malleolus. Okay. Articulates with the tibia and the talus bones of the foot to form the lateral portion of the ankle joint. And its several ligaments attach at the lateral malleolus to the tibia, talus and calcaneum. Okay, we will discuss the ligaments. So we have discussed head as a oval circular articular facet, one styloid process posterolateral to the articular facet and a sloping surface in front of the styloid process for C-shaped insertion of the biceps femoris. Here is insertion of the biceps femoris, one of the hamstring muscles. Next we are going to neck. Neck is the constriction below the head. Just below this head, this part is the neck. Okay. So neck is connecting the head with the shaft and the common peroneal nerve is related to the posterolateral aspect of the neck. This relation is very, very important. Okay. Posterolateral aspect of the neck is related to common peroneal nerve. Here the common peroneal nerve is dividing into two divisions, deep peroneal nerve and superficial peroneal nerve. Okay, if there is, and this is most common site of fracture of fibula. In case of fracture of the neck of fibula, there is high chance of injury to this common peroneal nerve and there will be foot drops and other sensory losses. Okay, so foot drop, this is given in your theory, long question. Okay, common peroneal nerve and foot drop, all this. So this relation is important and anterior tibial artery is related on its medial aspect, here on the medial aspect, anterior tibial artery. Next we are going to shaft. Shaft presents 3 borders and 3 surfaces. Okay, 3 borders are anterior border, posterior border, medial border. Medial border is interosseous border and 3 surfaces are medial, lateral and posterior surface. Okay, anterior border, it provides attachment to the anterior intermuscular septum of the leg in its upper 3/4. Okay, see this is cross section through the fibula. You can see here, this is anterior border, This one is medial border or interosseous border, and here is the posterior border. And in between the medial border and posterior border, here you can see another ridge that is known as median crest. Okay, and this surface is posterior surface, which is divided into two parts by this median crest. One is medial part, another is lateral part. Okay, in between the anterior border and medial border, medial surface. In between the anterior border and posterior border, lateral surface. Okay, so and there are muscle attachment we will discuss. So anterior border begins just below the anterior aspect of the head, and inferiorly it splits to enclose a triangular area which continues on the lateral surface of the lateral malleolus. You can see this border. This border extends from anterior surface of the head, then extends downward going to the apex of this flattened triangle, which is placed on the lateral surface of the fibula. So that's how you identify anterior border, anterior aspect of head up to the upper end of the triangle, okay, located on the lateral surface of lateral malleolus. Next is superior extents, and this triangular area, it has an anterior border and posterior border. Anteriorly, attachment of superior extensor retinaculum, and posterior border gives attachment to the superior peroneal retinaculum. Okay, anteriorly there is extensor group of muscles, and here will be the lateral or peroneal group of muscles. Okay, next we are going to posterior border. Posterior border extends from the posterior aspect of the head to the lateral margin of groove on the posterior surface of lateral malleolus. Here, this border is the posterior border. Okay, extending from the posterior surface of the head, extending downward up to this groove. Okay, posterior margin of the groove. Through this groove passes the Peroneus longus and Peroneus brevis tendons. Okay. So this is posterior border, and the posterior intermuscular septum of the leg is attached to its upper 3/4. Here is the posterior border, here is the anterior border. Two intermuscular septums are attached here. Okay. Intermuscular septums are extension of the deep fossa, okay, and dividing the leg into three compartments. Next is interosseous border or medial border. It lies close and just medial to the anterior border, separated from it by only by 3 millimeter in the upper part. Here, this is anterior border, just away from this, just medial to it. This border is the interosseous border. Okay, 3 to 4 millimeter away from the anterior border, and inferiorly it ends at the upper end of the roughened area for the interosseous ligament. Here, inferiorly it ends at the upper end of this roughened area, okay, where inferior tibiofibular joints are being formed. Okay, and interosseous membrane is attached along its whole length except at its upper end to leave a gap. At the upper end of interosseous membrane, a gap is there for the passage of the anterior tibial vessels. They are coming from posterior to anterior, okay, through this gap. See here, this is the interosseous membrane. Here is the gap through which it is coming in front, anterior tibial artery, okay. And so this is related medial to the neck, okay, and this is common peroneal nerve, which is related posterolateral to the neck of the fibula, okay. And this is styloid process, arcuate ligament, and other structures will be attached. So next we are going to the surfaces. Three surfaces are there. First is medial or extensor surface. It is the narrow. আচ্ছা এটাকে একটু বন্ধ করে দাও তো ভালো করে, একদম যা গিয়ে বন্ধ কর। ছিটকানিটা লাগিয়ে দেয় যদি লাগছে। Okay, medial or extensor surface, it is narrow and lies between the anterior and interosseous border. Anterior border and interosseous border. In between these two, here is the medial or extensor surface, and it gives origin to the extensor digitorum longus in the upper 3/4. See here, this pink colored one, that is origin of extensor digitorum longus. Extensor hallucis longus arises from the posterior half of middle 2/4. This is extensor hallucis longus, and lower 1/4 provides origin to the Peroneus tertius. Here, lower 1/4 Peroneus tertius. Okay, and you can see the extensor digitorum longus originates from whole width of its upper 1/4 and anterior half of the middle 2/4. Okay, so three muscles in this surface: extensor digitorum longus, extensor hallucis longus, Peroneus tertius. So medial surface is extensor surface. Okay, next we are going to lateral or peroneal surface. It lies between the anterior and posterior border. This is anterior border and posterior border. So this will be the lateral surface. Okay, two muscles are attached: Peroneus longus, Peroneus brevis. Okay, so Peroneus longus arises from the upper 2/3. This is Peroneus longus, whole width of upper 1/3 and the posterior half of middle 1/3. Okay, and Peroneus brevis arises from the anterior half of its middle 1/3 and whole width of the lower 1/3. So two muscles, Peroneus longus and Peroneus brevis. Peroneus longus lies superficial to the brevis. Okay. Next is posterior or flexor surface. Rest of the surface are included within the posterior surface, and this prominent ridge is the median crest. Okay, so it is dividing it into medial part and lateral part. Okay, so flexor surface or posterior surface, it is extensive, lies between the interosseous and posterior border. Interosseous border and posterior border. In between the two whole surfaces, posterior surface. Upper 2/3 is divided into medial, concave and flattened lateral part by a sharp vertical ridge that is known as medial crest. Here is the medial crest. Okay. Next, the fossa covering the tibialis posterior muscle is attached to the medial crest, and the medial concave part gives origin to tibialis posterior. So, medial part gives origin to tibialis posterior muscle, and the fossa covering this muscle is attached to the median crest. Okay. Next, lateral part attachment we will discuss. So, lateral flattened part gives origin to soleus in the upper 1/4. So this part giving origin to soleus. Okay, upper 1/4 soleus. And to the flexor hallucis longus in the lower 3/4. Rest of the part flexor hallucis longus. So this is a flexor surface. Okay. And peroneal artery descends along the median crest, and the nutrient artery of the fibula is a branch of this peroneal artery, and it enters the nutrient foramen present just above the middle of the posterior surface. Okay, so this you remember, nutrient artery is coming from peroneal artery, and nutrient canal is directed downward. Okay, so upper end is the growing end of the fibula. Okay. Next, we are going to the lower end of fibula. Lower end is expanded anteroposteriorly. This part is the lower end. To form the lateral malleolus, this projecting part is lateral malleolus. Both of the malleolus are given. Tip of the lateral malleolus, tip of medial malleolus given in your surface marking. Okay, practical, important for practical. And which presents four surfaces: anterior, posterior, medial and lateral. Four surfaces. Anterior surface is rough and round and provides attachment to the anterior talofibular ligament. Okay, anterior surface rough and gives attachment to this ligament, and a notch at its lower border provides attachment to the calcaneofibular ligament. Okay, so connecting the fibula with the different tarsal bones. Okay, next is posterior surface. This is posterior surface. It presents a groove. Okay, this groove lodges the tendon of Peroneus brevis and Peroneus longus, and the latter being superficial to the former. Peroneus longus is superficial to the Peroneus brevis. Okay, Next is, this is asked in your Viva, Bones Viva. This group gives passage to which tendons? Okay, you remember Peroneus longus and Peroneus brevis. Next is medial surface. Medial surface presents a triangular articular facet in front. See, medial surface, this is triangular articular facet in front, and the medial malleolar fossa below and behind. Okay, so presents a triangular articular surface in front and a depression known as malleolar fossa below and behind this. And the upper part of malleolar fossa, this is also important. Okay, attachment of the malleolar fossa, two ligaments are there. So upper part of malleolar fossa provides attachment to the posterior tibiofibular ligament, and the lower part to the posterior talofibular ligament. Okay, and lateral surface, this is lateral surface, it is triangular, and this is subcutaneous. Okay, so all the four surfaces of lower end we have discussed. So see here, this is medial surface, this is triangular rough area, give attachment to the interosseous ligament connecting the lower end of tibia and fibula, forming inferior tibiofibular joint. This is the triangular facet articulates with the talus, and this is malleolar fossa below and behind this facet. Gives attachment to these two ligaments, posterior tibiofibular ligament, posterior talofibular ligament, and along the anterior margin these ligaments are attached. Talofibular ligament, anterior talofibular ligament, and the calcaneofibular ligament. Okay, understood? And these are the different surfaces and their attachments. Medial surface is the extensor surface, three muscles, extensor digitorum longus, extensor hallucis longus, Peroneus tertius. Lateral surface is peroneal surface, two muscles, Peroneus longus, Peroneus brevis. Longus is superficial to brevis. And posterior surface is flexor surface, divided by the median crest into medial part and lateral part. Medial part gives attachment to tibialis posterior, and the fossa covering tibialis posterior is attached to the median crest, and the lateral part gives attachment to soleus upper 1/4 and rest 3/4 flexor hallucis longus. Okay, understood? Muscle attachment you remember from this picture. Okay, so see here the interosseous membrane and the muscle attachment. Here is the flexor surface, okay, or lateral part of the posterior surface. This is posterior view of tibia and fibula. Okay, so this is soleus, attachment of soleus, and this is flexor hallucis longus, and this is median crest. Medial to it, here is tibialis posterior. Okay, and this is the lateral surface is extending here. Peroneus brevis can be seen. This is anterior view. This is peroneal surface or lateral surface. Peroneus longus above, Peroneus brevis below. Okay, and this is anterior or medial surface. This is medial surface, anterior border and the interosseous border. So this is the extensor surface, extensor digitorum longus, extensor hallucis longus, and Peroneus tertius. Okay, and here is attachment of the capsular ligament of the ankle joint, and see the relations of neck. At the upper end of interosseous membrane there is a gap for passage of anterior tibial vessels. Artery have been shown here, and on the lateral part of the neck common peroneal nerve dividing into two terminal branches, and here is at a C-shaped insertion of biceps femoris at the head, and at this is styloid process arcuate ligament is attached. Okay, and fibular collateral ligament is also attached here. And this is cross section through the leg. This is tibia, this is fibula connected by this interosseous membrane. Here is the anterior border, posterior border, and the interosseous border. Then three surfaces, this medial surface, lateral surface, posterior surface, divided by the crest into two parts, medial part, lateral part. Okay, and this anterior border and posterior border gives attachment to anterior intermuscular septum, posterior intermuscular septum. Next we are going to the anatomical position and site determination. Very important, these points you must remember. So the site of the fibula can be determined by holding it vertically in such a way that the rounded end called head is directed upward. This is rounded end, and you can see this is flattened end. So rounded end will be above. So above and below is done. Next, it is relatively flattened end is directed downward. Okay, malleolus will be directed downward, and a triangular articular facet at its lower end faces medially. This articular facet will face medially. So medial and lateral is done. Next, a depression at the lower end that is known as malleolar fossa lies behind and below the triangular articular facet at this lower end. Okay, so this malleolar fossa is below and behind this triangular articular facet. So you follow all these points, it will be placed in the anatomical position. Okay, so this is fibula of right side. Hold it like this. Place your thumb in the malleolar fossa and other fingers on the lateral surface of the lateral malleolus. Okay, so hold it like this. So above, below, head is above, malleolus is below. Anterior, posterior, triangular facet is anterior, malleolar fossa is below and behind, and medial, lateral, this facet at the lower end is directed medially. Okay, understood? And this styloid process is posterolaterally placed. Okay. Okay, so everyone will be able to hold this anatomical position. You practice. Okay. Next, we are going to ossification. Okay, ossification you remember for fibula, very important. Explain why question comes from here. Okay, so fibula ossifies from three centers, one primary center and two secondary center. Primary center appears in the middle of the shaft at the age of 8th week of intrauterine life, and secondary center for the upper end appears at 3 to 4 years and fuses with the shaft at 20 years. Okay, and for the lower end appears at 1 to 2 years, fusion with the shaft occurs at 18 years. Okay, so you can see here the upper end appears last, fused last, and lower end appears first, fused first. Okay, so it is violating the rule of ossification. Okay, so why it is occurring, you have to know why there is violation of this rule of epiphysis. That comes in your explain why question. Okay, this is the answer. So in fibula, law of union of epiphysis is violated. According to this law, epiphyseal or secondary center which appears first unites last with the diaphysis. But in fibula, epiphyseal center for the lower end appears first and also unites first. And this explanation to this violation is that epiphyseal center in the lower end of fibula appears early because it is pressure epiphysis, because it is carrying the body weight lower end, okay, forming the ankle joint. And as the growing end of fibula is its upper end, that's why the upper end unites with the diaphysis last. Okay, although its epiphyseal center also appears last. Growing end, how you determine? According to the direction of the nutrient artery, okay, as evidenced by the direction of the nutrient foramen, okay, which is directed downward. Next, some clinical aspects we will discuss. Bone graft. Okay, fibula is most commonly used bone for bone graft. In case of any bone cancer, you have to remove some parts of the bone. Okay, so then you have to place some bone graft for regrowth of the bone. Okay, so why fibula is used? Because it is most commonly accessible and it does not have much function. It does not carry the body weight much. Okay. So bone graft, as fibula does not take part in transmission of body weight, it is a common source of bone for bone grafting. Okay. Next is fibular fracture. Fibula is commonly fractured 2 to 5 centimeter proximal to the distal end of lateral malleolus. Okay, so near the lower end, most common fracture site. And neck fracture is given in your theory. Neck fracture, you will be asked, given a patient with neck fracture comes with this symptoms, how will you diagnose the case? And rest of the question will be asked. Okay, so most common site is this 2 to 5 centimeter proximal to distal end of lateral malleolus. It is often associated with fracture and dislocation of the ankle joint. Okay, understood? So these are the clinical aspect. This very frequently given, explain why. Why there is a exception or violation of rule of ossification at lower end of the fibula. Okay, you prepare it and those explain why. And fibula is given in your bones fiber axial skeleton. Today only you go and read fibula, otherwise you forget. Borders and surfaces are very difficult to identify. Okay, go home and read today. And after the class, you see on your own, hold it in anatomical position. It is a tough one, okay? Okay, any queries from this topic? No queries? So everyone will be able to hold it in anatomical position. This will be the anatomical position, right fibula? And how will you articulate?